And moving on, our next speaker takes us into one of the most fascinating and underrated aspects of health, sleep. So, Dr. Kunal Kumar is an American board certified neurologist and sleep medicine specialist and currently serves as the Associate Director of Neurology at Medanta, Patna. Before joining Medanta, Dr. Kunal worked in the United States as the medical director of the sleep lab at Jefferson Einstein Hospital in Philadelphia, where he established a state of the art sleep lab accredited by the American Academy of Sleep Medicine and made significant contributions to advancing the field of sleep medicine in the community. A clinician, researcher, and educator at heart, Dr. Kunal's work bridges cutting edge neuroscience with practical insights that help us understand what truly happens when we rest. Today, he'll take us on a journey through the science of sleep architecture. So, without further ado, please join me in giving a warm welcome to Dr. Kunal Kumar.
Uh, Thank you, Shagun, for the kind introduction.
This one. So you can directly point it. This side point. Okay.
Okay, and next slide.
Before and after.
This one. Okay. So I guess it's a great time to talk about sleep. It's been a long day, and I guess we are reaching towards the end. Everyone is a bit sleepy and tired, and I guess I'm going to tell you in a minute or two why we feel that way. Some people were talking about tea or caffeine, and we had a great dance presentation as well. So great job with the dancing whoever were there on the stage. So why sleep is needed? We can say that we are wasting our life. Life is precious, but sleep is very important aspect of life. It's when we are sleeping, it's resting stage, but it's active, ongoing, and a dynamic process. So quality of sleep is not only defined by the number of hours of your sleep. So it has two aspects. It's not only duration, it has to have a good architecture, good circadian rhythm as well. Then only you're going to get the proper benefit out of your sleep. So when we understand why we talk about sleep so much, a few of the speakers have already discussed. As a society, we are sleep deprived. I think there was a study a few months back, and I read somewhere that 60% on that survey said they have less than 6 hours of uninterrupted sleep, so which is poor sleep. So as a society, I think we are failing, and we need to talk more about it. Um, so these are the initial days when Howell et al. Studied in 1895. Those were the initial attempt to study what exactly is going on in the sleep that was done at Johns Hopkins. Then there is also a landmark trial. We call it Mammoth Cave Experiment. When we started our sleep journey as a clinician, we were told these are the, one of the first few study. What Dr. Kleitman did along with his research assistant, Bruce Richardson, they locked themselves in the Mammoth Cave, Kentucky for 32 days without any external stimuli, no light, no clocks, no social contact. And they were sort of documenting themselves, like what exactly is going on. So what result came out of that? That was the first time world realized that there is a body clock. There is a clock that governs your day-to-day activity, and that was the first time they realized about this biological clock. We call it circadian clock, and that was the one of the landmark. They also noticed that internal rhythm holds for about 24 to 25 hours, and it goes in cycles without any external stimuli. You can change it with the light, but you don't need it. So that is the inherent biological clock already placed in your brain. So that was the foundation for the modern, chronobiology. You can see these were the two guys who were conducting the experiment. They were coming out of this Mammoth Cave, Kentucky, and this was the, as I said, the initial few research. So how modern day sleep research or sleep lab looks like. This is the sleep lab out of University of North Carolina, Chapel Hill. That's where I was trained. So you can see a lot of gadgets. What Ritesh was talking about, how technology has intervened in the field of healthcare, and we cannot ignore it. You have to embrace it because that's the future of the healthcare. So what we see as an output, you record all these study, this is your interface, and this is the data what you're going to get. This is your brain activity, this is your heart activity. And then there are lots of other parameters we record as well. We have talked about the experiment. what they studied about the sleep. So this is the image. This is our, Professor Will Dement out of Stanford. I think Ritesh had some connection with California. So he's one of the founder of modern sleep medicine. He did a research with his student, how long you can sleep deprive yourself before your body or brain starts failing. So I guess this is the world record, Guinness Book of World Record for sleep deprivation. That was about 11 days. They said that it was not safe enough to continue after that because you start seeing the evidence your body is failing, your brain is failing, you start to have hallucinations, psychosis, your metabolism is all over the place, your vital parameters are affected. So 11 days is the record that has been documented. I guess it's the Guinness Book of World Record. There was a study, I guess, out of University of Chicago. They did it on animals, like how long you can sleep deprived. That was done on rats. And I think 2 to 3 weeks was the max where animals started dying because of the sleep deprivation, because there is metabolism failure, multi-organ failure, immune failure. So those are the initial study. So what actually drives sleep? There are two modes of it. One is circadian drive, the one that we discussed earlier, that there is a biological clock in your brain, and other one is homeostatic drive. So let's go a little bit deeper into that. So internal biological clock, where is this clock located? So that is in your brain. We call it suprachiasmatic nucleus. That is in your hypothalamus. So what it does, it is driven by the light and dark cycle. So whenever there is a daytime, your eye senses that this is the daytime or the right nighttime. They send the signals back to your brain to release melatonin or not to release melatonin. So what happens in the evening, your retinohypothalamic tract gets active, means your eyes are sensing that this is the dim light, and it sends the signal to the pineal gland that is in the brain, and they start releasing melatonin. So that's how your body gets sleepy, and you have a little bit of your body temperature also starts to go down. So melatonin, temperature, and those are two things that is the core why we feel, again, sleepiness from the circadian standpoint. So what happens, if you look at the graph here, just right about at 6:30 to 7 o'clock, this is your dim light melatonin onset, and then it goes up and up and up. And when you're early in the morning, you see the decreasing trend in the melatonin melatonin level. The second is core body temperature here. Again, the same thing. You see the dim light melatonin onset, melatonin is rising and your temperature, body temperature is going down. So it's very much aligned with your circadian clock. What happens to your stress level, plasma cortisol, stress hormone level? Again, the same thing, it goes down. And in the morning, you start seeing more and more cortisol, and it gets maximum around like 8 a.m. in the morning. So there is an inherent rhythm to it. Somebody was talking about the T. That is part of my slide as well. So what happens in the homeostatic drive? So far, we have talked about the body that governs your sleep. Now you have a homeostatic drive. The far you are away from your sleep, the longer you are away from your sleep, that is your sleep deprivation. So you build up a drive that is called a homeostatic drive. It is governed by a chemical called adenosine. Adenosine starts to accumulate in the brain. And what happens when you have more adenosine in the brain because of sleep deprivation, because you're, are tired for utilizing your brain energy and stuff? You feel sleepy. Why we like to have tea or caffeine? What caffeine does to it? It has a direct role. So what it does, it temporarily blocks the adenosine receptor. There are adenosine receptors in the brain. So your body perceives that there is no adenosine because caffeine is blocking it. The moment caffeine is out of your system or the tea is out of your system, you'll still feel sleepy again. So they work on these receptor A1 and A2A, temporarily reduction, and it does not really remove the adenosine. So that is your homeostatic drive. I think Mugdha had placed the dancing steps right, in this dip. So you see the alertness level, and this is your circadian wakefulness drive. It peaks up around the noon time, and there is a certain dip. This is because your body temperature goes down a bit. It's kind of dark in here. So we will all a bit sleepy and drowsy, although some people did not accept it, but that's fine. It is normal to have that dip in the afternoon. So they strategically place that dancing move here. So look what happens in the homeostatic drive. It goes up and up and up until you are sleepy, and then it goes down. So here you start seeing the circadian wakefulness drive. It is going down. After I would say in the evening, again, everything is aligned with the sunlight. Now let's talk about the sleep architecture and why it is important. So sleep is consist of two parts: the non-REM sleep and the REM sleep. Non-REM is divided into three. It used to be four, but now they concluded three and four together as a tree. So you have very early stages of sleep. You're just drifting from arousal state to sleepiness. That is your N1. You have N2, and N3 is the deepest sleep. It is very difficult to wake someone up from the N3 stage of sleep. If you do wake them up, like kids, if you have to wake them up for the toilet break or something, they would be confused or groggy. And then you have REM sleep as well. So that's your sleep architecture. What happens to the sleep when you have uninterrupted good night of sleep? It has a rhythm to it. You go from non-REM sleep. Initially, when you are working on your homeostatic sleep drive, your slow wave sleep is higher and higher. And towards the end of the night, the non-REM sleep goes down and REM sleep goes more and more. So you tend to dream and then you wake up with the REM sleep in the morning. So look at all these red, that is your REM sleep, rapid eye movement. So in the first period, that starts around like 75 to 90 minutes. So here you have very short REM, but then N3 is longer. N3 is going smaller and smaller towards the end, and your REM is going more and more, longer in duration. And here you just wake up from the REM sleep. Each cycle is again 90 to 110 minutes. So remember, if you keep waking up after certain hours, that's not a good quality sleep because you're interrupted, your cycle is interrupted. So you have to have that consistency. And again, these are the neurotransmitter. I'm not going to go in detail, but these are the wake promoting neurotransmitter. A lot of people have already discussed about it. Here is your sleep promoting neurotransmitter. Mainly, whatever is the monoamines like excitatory is going to be your wake promoting. And then GABA and galanin are the major sleep promoting neurotransmitter. This is the slow, when you start drifting into the sleep, look what happens. This is your eye channel. So your eye is having slow roving eye movement. That is the first hint that your body is drifting from awake state to the sleep state. So that is the first half. That is, I said N1, that is the initial starting of your sleep phase. Then you go into N2. N2 is characterized by all these sleep spindles. They are 12 to 14 hertz activity coming out of your thalamus. And then you have this large high amplitude or high voltage activity, that is the K complex. So this is somewhere in between. This is not the very deep sleep. This is also not very superficial. So most of the time you may be in N2. All right. So N3 is the slow wave sleep. It is important to talk about it. What happens in N3 stage? We always talk about the slow wave sleep. There is a reason to it. If you look at the brain waves, so brain waves is classified based on the hertz activity. So your brain activity is at the lowest when you're awake. It is somewhere around your posterior dominant rhythm is 8 to 12 hertz. And this is as low as you can go. So in your slow wave sleep, your activity is 0.5 to 4 hertz. There is a significant reduction in energy consumption of your brain activity. Your muscle tone is not as awake state, but it is also not as REM sleep where you have muscle atonia. We're going to talk about that in the next few slides. You do not have any rapid eye movement. That is characteristic feature of the REM sleep. Your heart rate, blood pressure, and respiration, we see them when we put our patient in the laboratory. The first half of the sleep, their blood pressure, their rhythm, everything is very regular. Why? Because there is a chemoreceptor in the body. Those chemoreceptors have very high threshold during the slow wave sleep because your body is trying to process something, recovering from the daytime stress. So they have very smooth pattern of breathing, heart rate, everything is very smooth because their parameter is set at a very high threshold. Body temperature, it decreases when you're sleeping, and as I said earlier, it is very difficult to arouse someone from the this stage. Now look at the EEG activity. We record the brainwave or the EEG activity. We call it delta waves. So this is 1, 2, 3. So maybe 2 to 3 hertz activity that is going on inside your brain. That is the slowest. So that's why we call them the slow wave sleep. What is the function of the N3? So N3 is basically the restorative stage where you are healing from wear and tear. So people who are young and they are trying to rely on less sleep. It's not good for them because if you exercise, if you're trying to work on something, your body needs to recover because your muscle growth, everything, memory processing happens in your sleep. Your stress level is going to go down. And memory consolidation happens in both like non-REM and REM sleep. What happens in non-REM sleep? They store mostly your factual memory. Like if you guys are in med school, you learned something that is factual, like 2 plus 2 is 4. So your brain is going to process that information and save it into the brain in your slow wave sleep. Energy conservation happens as well. I'm going to go a bit faster. So what is the REM sleep? REM sleep is characterized by rapid eye movement and muscle atonia. Your muscles are, at the lowest tone level, except few, like breathing is vital. So that muscle is not going to get paralyzed. You have eye movements, so your eye muscles are not paralyzed as well. Autonomic activity changes. This is more like an awake state. Autonomic activity changes means your heart rate is more like when you're awake. Blood pressure, respiration is not going to be as smooth as it used to be in your slow wave sleep. Dreaming is very peculiar in REM. You will have very vivid dream, emotional story-like dream. Those dreams are different from the non-REM stage. These are the eye movement, rapid eye movement, which I was talking about. What is the function of the REM sleep? So non-REM sleep, remember, it's a more sort of restorative. REM sleep, it happens memory consolidation and it has a lot to do with the emotional processing. So non-REM memory, remember, was factual. This one, whatever skill you have learned. So skill memory is going to be saved during your REM sleep. I'm going to take a few more minutes. So in the REM sleep, what happens? When you're talking about the emotional stuff, it is important. So I'm going to go quickly onto that topic as well. If you have depression, all those events, PTSD, schizophrenia-like event, your body sort of dampens those distressing emotional stimuli. So it is very important to have that REM sleep as well. So you need a bit of everything. Neurodegenerative stuff can happen if you have REM behavior disorder. You have very high chances of developing, Parkinson's disease 10, 15 years down the road. Narcolepsy can happen. Poor architecture of sleep has been linked with cognitive decline, high blood pressure, metabolic syndrome, depression. Sleep changes with age. Your slow wave sleep is going to go down when you get older. So initially, adult gets like 7 to 9 hours. Older adults maybe like 6 to 7. But the important thing is their slow wave sleep quantity is going to go down. Dementia risk increases significantly if you sleep less than 6 hours. And this is the study that was, I think, done out of UK group. What they noticed, there is a 30% increase if you sleep less than 6 hours. This is your lymphatic circulation. People were talking about lymphatics before, and this is the A beta amyloid deposition in your brain if you don't sleep well, because all the cleaning happens in your sleep. So try to get good quality sleep, 7 to 8 hours. Assessment tools. I think Ritesh put some information about how technology is shaping us. So gold standard is going to be remain like polysomnography in the laboratory, but you have a lot of watches or a ring. We use it a lot these days. So these devices, they use different parameters. They monitor your heart rate, they monitor your temperature, skin conductance, and they estimate the sleep stages. But remember, they give you the REM sleep idea, but it is not going to be precise. The best way to know is put an EEG lead on your brain, and that is the gold standard. But still, you get some input about it, like your sleep is interrupted. How we make our sleep better? Keep a consistent schedule, like go to bed 10:30, wake up at 6:30. Optimize your sleep environment, like keep your room dark, quiet, and not too cold or not too hot. Limit your screen exposure to bed. A lot of us has habit to put like phone in front of us whenever you're going to bed, and before you realize it's already midnight. Relaxation techniques are important, and I got one more. Watch your intake, what you're taking. Alcohol is a big one. If you drink alcohol, it's going to be detrimental to your health. Avoid caffeine and sunlight and everything they have discussed about. If you nap, only limit it to 20 to 30 minutes. And I guess tools he has already discussed, so I'm not going to go in detail about it because of the time constraint.
Is it okay to
Yes.
split the day? It is helpful.
Say that again. Naps, if you take shorter naps, it's good. But if you take long naps, that's going to decrease your homeostatic drive. So it's not advisable. But 20 minutes is fine. 20 to 30 minutes. Yep.
Dr. Kunal, I
Yeah.
have a question.
Yes. Sorry.
This back bend.
Yeah, I can see. Yeah.
So I have two questions. One, I was reading about biphasic sleep patterns that were followed by the medieval humans.
Right.
So wanted to know your thoughts on that.
Yes.
Things have changed post the industrial era. So was that the way to live, and are we sleeping for 8 hours a night? Is it the natural way to do things as humans? And secondly, the standard recommendation, which you also mentioned, is around 7 to 8 hours.
Yes.
So do you think that applies to everyone, or does it change from person to person? We're just finding out that women need 1 hour more sleep than men on average. So just wanted to know your thoughts on these two things.
Okay. I think you have asked two questions. First about the sleep continuity and whether you need a break. So what happens, our sleep changed with the industrial era. That is correct. So if you're talking about the current social environment and our surroundings, so that does not help siesta, or if you can take siesta, if you complete one cycle during that, that's great. Like, it's fine. But suppose you go right from the N1 to N3 and so you have to wake up, you're going to be very, very groggy and confused. So that's not a good idea to do that. So short naps are okay. In the current environment, I would suggest keep the consistent schedule in the evening, because that's how our society runs these days. Like, you have a dedicated 8 hour working schedule, you go home, you relax, and you go to bed. So in this context, I would say where we are living right now, I would say in the evening, 10:30 to 6:30 is the best. And the second question, I think you're talking about the duration of the sleep. So very, very few people, they have short sleeping genes. Not everyone is going to have that. So if you have any daytime effect from your insomnia, if insomnia is bothering you, suppose you sleep 6 hours, right? You have no symptom tomorrow, you're running fine, you have no drowsiness, grogginess, you might be okay. But remember, we are talking about, there's a bell-shaped curve when you talk about the statistics. So they say if you're 2 standard deviation above and below, yes, it's a possibility. But remember, those numbers are very far and few. So most of them, they're going to fit into that bell-shaped curve. So 7 to 8 hours is recommended, but 6 hours, yes. And female, their sleep changes with the menopause. So, I mean, in the beginning, it's fine. And then they have more tendency to have sleep-related breathing disorder later in their life. Like after menopause, they're at more risk for having sleep apnea versus before menopause. So things changes, but I'm not sure that if they need less sleep than men.
No, women need more sleep than men is what the latest research says. So I just wanted to ask you what your thoughts on that. As far as the napping thing that you mentioned, right? So the biphasic sleep pattern that I'm talking about, back in the day, what used to happen is people used to sleep by dusk.
Yeah.
They used to wake up for
3 hours in the
yeah, and then they used to sleep again for another 3 to 4 hours. So this is the biphasic pattern that I'm talking about. Was that the right way to do things, or was it this consistent 8 hours of sleep a night the right way to go about it?
As I have said earlier, if you can do it, it's great. A lot of people, they cannot do it. In the current context, like what fits most is going to have a consistent schedule. But if you think that what we were talking about earlier, the first 90 minutes, if you can complete it, and then you're trying to wake up after completing that REM cycle, it's great, but you may have to put in some sort of alarm. And again, what those women research you are taking, I'm not sure the need. I would say 7 to 8 hours still fits most of them, but some women may have more need because of their responsibilities. Now they work outside as well, their home responsibilities. So you, depending on your exertion, you build more homeostatic drive. So it's person to person varies, but I would say most of them, if they sleep 7 to 8 hours, it should be fine. Yeah.
Thank you.
One
Yes.
question. This is more of a personal problem. Continuation to the napping.
Yeah.
You are not given very favorable support to napping. But in my family, the core family, 4 of us, whenever we travel,
Yeah.
whether it's an airplane or it's a Shatabdi kind of train, all 3 of them sleep and they get up very fast. They are more fresh. And I'm reading or doing something like this. So how do we learn the art of napping? Is there any Has science has given some tool?
Good, good question. I mean, if I have a chance, I mean, I would love to sleep in the afternoon as well. But my thing is that if you sleep longer, it's going to mess up your nighttime sleep. So if you can afford that, like if you afford one cycle during the afternoon, what she was telling that pre-industrial era, they used to sleep earlier in the after, I would say sunset, and then they used to wake up for the other activities, and then they go back to bed again. So the key is that if it does not affect your sleep at night, you're fine. If it start messing up your sleep, in my experience, most of the patient, they would come for me as insomnia patient. I'm having difficulty falling asleep at night. And when you ask them, they will say, I take a nap for 2 hours. So if it does not bother you, fine, go ahead, do it. But if it does bother you, then you probably don't want to do it.
Hi, doctor. Just
Yes.
can I
Doctor
just
here.
repeat one question? Yeah, just wanted to know, sir, if somebody has issues with sleep, so what is your recommendation for it? Like
Issues with sleep in the mean, like what kind? Yeah.
like somebody who is depression or something like that and is struggling with sleep.
Okay, so depression is altogether different. They used to club it together, like insomnia associated with depression, but American Academy of Sleep Medicine, they separated these two things. They said that is a behavioral issue, that is a mood disorder, and insomnia is different. So you need to address both. But again, when they come to you, it is important for us as a clinician. When they come to us, there's like, I cannot fall asleep. So then we hear all this stuff. We try to find out why. First, most common stuff, do you have any sleep apnea disorder? Like, are you having any breathing issues? You wake up at night because of the breathing challenges. Second, is there any recent stressor? Is this acute? Is this chronic? Then the third one is the comorbidities, what you said.
IT people like the stressful jobs and all, when they come and they say that we have sleep issues because of our stress.
Yeah. So I did not go into that slide. So when you go to the bed, keep yourself at least an hour of unwinding time. That should be your time. Put your phone away. World is not going to fall apart because your phone is away from yourself. Try to focus on things like what you like. If you have hobby to read, then you can read. Reading is great. Some people take shower. It decreases your body temperature. That helps you fall asleep faster. Then you start on focusing like what exactly you want. Like sometime I feel like, okay, I'm tired. I just want to distract myself. I start reading a book, or I start journaling. Like if you like journaling, then you can journal. Mindfulness is big one. Meditation is a big one. Towards the end of the day, you don't want to do again stimulating things like exercise is going to build your homeostatic drive, true, but earlier half of the day, not like very close to the bedtime. So I would say probably for these things are more about de-stressing, so meditation, yoga, a little bit of holistic stuff, you can do it as well. Yeah.
Thank you.
So I had a question.
Okay.
That
I think
question is,
Shagun is
you are sitting in a class and you're feeling sleepy.
yes.
You are in an auditorium. As speakers are made to sit in the first line and not permitted to sit back. And Mukta is looking at you and you're feeling sleepy. So what do you do about it? And you're forced to stay awake. Is that sleep deprivation?
When you I guess Mugdha should have answered that question. I mean, of course, you're putting your speakers at risk for sleep deprivation. Sure, I think we are running short of time, but yeah. Okay, that's a great question. Popping pill is never an answer. Sleep has to be natural. The safest pill is melatonin. I completely agree with that because it is something that is endogenous and you're taking it. That is, it's good, safer than most of the pill. But anything you take that comes with some side effect. Like some people will have grogginess out of melatonin as well. So if you have to take melatonin, what I usually do in my patients, I keep them on a very short-term basis. But if sometime it's needed, I always try CBTI along with that is a cognitive behavioral therapy for insomnia. So go natural way, like good sleep hygiene means circadian rhythm, like sunlight and all those things. But melatonin, the short answer is it should be for the short term, not as a regular, regular therapy.
The electronic devices, sleep on demand.
Yeah. Sleep on demand, you're talking about like the.
Electronic devices, you just put them on and you start feeling sleepy.
So that is different. If you are talking about like there are apps as well, calm app that will give you sort of monotonous noise. So some people, we call it white noise. So if that helps you, it's great. You can use it. Yeah.
Okay, guys. Okay. Okay. Sorry.
Say that again.
Yeah. More time, yes.
No, it's good to know that people are having questions about their sleep. So it's great to know. Thank you. Thank you.
Most environments being sleepy, it is not necessarily something boring or something. It could be carbon dioxide. We've been doing some study about it. The amount of carbon dioxide in the air makes you a little drunk.
That's an interesting fact.
Speaker changes, you wake up.
Okay. Thank you, Dr. Kunal. That was truly awakening. You've reminded us that sleep isn't just downtime, it's the body's most intelligent repair system, quietly restoring our mind and nervous system every single night.